Hello, Kate. Thanks for joining us today.
Thank
Uh, I thought we'd start by asking what really are the main advantages of using patient and public data in NHS research and healthcare planning?
you. So I think one of the key things that's so critical is that without patient data, without the public's data, um, it is virtually impossible to plan services, but also to develop kind of improvements to healthcare systems or new drugs or new innovations in terms of healthcare that can benefit the community. So having access to patient care, whether it's via clinical trials and volunteers that kind of participate in specific studies, or access to routinely collected data that happens at your GP practices, or when you attend hospital, or when you actually just drop off your prescription and pick it up from a pharmacy. All of that information can be brought together and generated to create incredible insights, not only in terms of just how people use healthcare services, but ways that we can improve healthcare services depending on a person's um, demographics. So, like their where they live and how they interact with healthcare services. It's also about kind of new innovations and technologies that can be created from generating all of this data in a way that helps us understand how patients interact with healthcare services, but sometimes also how they don't interact with healthcare services after they've had a diagnosis or after they've had like an injury or things like that. What we're trying to do is improve care and treatment of patients and the public. And without that information, we're in a position where we're just repeating the same old thing rather than actually developing new solutions, new treatments, and new ways of managing healthcare.
And those advantages obviously touch the lives of nearly every member of the population.
Absolutely.
Against that, are there any risks, any threats regards data sharing? And if so, how are we in the secure data environment of Yorkshire and the Humber? How are we mitigating those risks?
Yeah. So one of the things that has kind of historically happened in kind of healthcare research and health treatment research, so when in terms of pharmaceuticals or other kind of interventions, is that it oftentimes rely on volunteers. And that's incredible. And we want people to volunteer to take part in research. But one of the challenges that you have is when it's only volunteers, is that tends to be like a self-selecting population. It's people that feel comfortable and understand very complex parts of the healthcare system that not everybody might know or understand or have access to understanding. In thinking about like my own interactions with the healthcare service, like it's come from many, many years of interacting with systems and asking questions. And so one of the challenges that we have on a completely volunteer basis is that we know that some communities don't always volunteer in the same way as other communities. And this creates disproportion and imbalance in terms of treatments that are delivered, in terms of services and how they're delivered. We know that underserved or deprived communities have drugs that aren't developed like with their needs in particular, or don't get services and interventions that maybe they need because of the particular makeup of the community. So I think one of the things that the secure data environment is doing is really kind of thinking about healthcare in its most equitable sense. And the most equitable way we can deliver healthcare is by using all of the data that's collected, not just data from volunteers or people with high kind of health literacy or understand the system or who have done many years of education. What we're looking to do within the secure data environment is make all of the routinely collected care health data available to researchers, which kind of balances out that kind of inequality in the system. One of the things, though, that comes with is a duty of care around patient privacy and confidentiality. It means that if my records are in a particular data set, you don't know it's me. or if your records are in a particular data set, a researcher doesn't know it's you. What that we can do is give access to that data within a highly restricted environment with robust research ethics around it. So a researcher has to demonstrate clear public benefit to their research. And then we can do an extra layer. So we do an extra layer in the space in which they access that data for research, which is making it highly restrictive without having access to the internet, without being able to actually get any of that data out. And then we can also do a third layer, which is making the data safe. So by taking out things like names and addresses and dates of birth and replacing them with other things. Yeah. So your NHS number just gets a random study ID number, your age, rather than your date of birth. So we can then kind of put all of these additional layers of privacy, confidentiality, and technical and process solutions, which keep all of that routinely collected data safe and secure. It also means that none of that individual level of data can leave that environment. If there's no internet, there's no way that could be just emailed out, for example. All of the data itself goes through a really kind of robust process. So where a researcher might do kind of statistical analysis, like how many people responded well to this drug and how many people didn't respond well to that drug. We all of that kind of analyzed data gets checked further before it leaves the environment. So what we're doing there is making sure that when a percentage leaves, or like a chart or a graph or some kind of visual or little points on like a visual chart, that can't potentially identify an individual. That is entirely like the kind of ethos behind making all of this routinely collected data available for research. The public are giving us that data because it's routinely collected in their GP practices, in hospitals, etc. But it's our duty of care to the public to make sure that data about them stays safe and secure, and that we're not potentially putting anyone at risk of identification.
That's really reassuring. Now, there's no shortage of research talent here in Yorkshire and the Humber, whether it's in universities where you work or in the NHS. Could you be kind enough to give us one example, a homegrown Yorkshire and Humber success story?
Yes.
How all that data is being brought to life and turned into a real benefit for our communities?
Absolutely. So at the University of Sheffield, we have a research database known as Cured Plus, and it is a research database specifically around accident and emergency data and people that use urgent care services. That data is provided to us at a national level from NHS England. So we have a national database of things like emergency attendances, when people are admitted to hospital, when they actually their outpatient attendances, so when they attend a clinic in a hospital, what medicines have been dispensed, so what medicines have been filled at a pharmacy or at people's local chemists. We have taken that kind of national data and we've linked it to the Yorkshire Ambulance Service. So we've linked in anybody that has used or called the local ambulance service. So their 999 calls, their 111 calls. So we've made this huge kind of step in being able to link in the Yorkshire and Humber ambulance service to then see what happens after people call 999 or 111 and what kind of pathway they follow through the system. One of the specific projects that we're supporting right now at the University of Sheffield is for people that call ambulance services that they've fallen and they've had a long lie after they've called. So what we mean by long lie is they've called, they've fallen, and it takes quite a long time for the ambulance service to attend them. And that's usually due to pressures. It's usually due to winter pressures where lots of additional accidents happen because of weather and things like that. And what we're looking to do and help support by making this data available to researchers is understand the outcomes of those patients. And they're usually older. They're usually patients that may have mobility issues to begin with, etc. What happens after they've had a long lie and then they get admitted to hospital, and understanding their flow through the hospital. Do they have longer hospital attendances? So do they stay in hospital longer? When they get discharged, do they have readmittances within a short period of time? Do they have additional complications? This kind of research is very much focused on how do we improve like service provisioning? How do we reduce the times that people who have had this long lie before the ambulance is able to attend to them? How can we reduce that? Like what are the factors for success and healthy kind of recovery versus the factors that may add in additional complications? So that's the kind of real world kind of treatment we're looking to help by bringing together all of this data.
That's a great example. So if someone wants to find out more about data-driven success stories like that, where can they go to find and read a bit more about the ongoing progress that's been made by CureED?
Yeah, so for the Cured Plus data set, so it's CURED Plus, we have our website at the University of Sheffield. The service provided there is by one of my teams called Data Connect. Additionally, in Yorkshire and Humber, we have the Yorkshire and Humber Secure Data Environment, and we maintain a register of all of the projects happening across the region. So people from North Yorkshire and Humber can see what's happening there. People from West Yorkshire can also see the research happening there, and the same for South Yorkshire. So there is a wealth of information. We want to make this information as open and accessible as possible so that the public know how their data is being used and the contributions their data is making to improving services in the NHS.
Brilliant. We'll pop that website address up on the film. Finally, I suppose a bit of call for action, really. What you've described has probably whet the appetite of quite a few people out there who want to contribute to the success of health research. How easy, how difficult is it for them to get involved?
So the easiest way is just go to your hospital appointment, go to your GP appointments. All of that data is being collected to make sure that you can have your health improved and your outcomes improved. And we can use that data to do all of this kind of like underlying background research that's in the public benefit. You can also participate in clinical trials. So all of the major universities in the region have clinical trials units and are always looking for volunteers. There are lots of other organizations across the NHS and third sector as well that absolutely are all of these health innovations and insights and advancements are driven by volunteers. And I'd say finally, one of the other things that's really critical is if people that are interested in health research and health data research want to take part in some of our public activities. So we run different kinds of focus groups or things called citizens juries or other kind of public information and engagement sessions where we offer like case studies out to the public to actually give us feedback. I myself undertake research and I look at, all of our insights are very much co-developed and tested with the public before we do anything. We want to make sure that our approaches actually benefit the public and the public have an opportunity to feed back into that research. So anytime there's a call to action that's kind of via a public group or, just if you're interested in health data research, you can absolutely get involved in so many different ways.
That's super. Thanks very much for your time.
Thank
Really, really entertaining and informative insight. Thank you.
you.